Hi, Assalamualaikum warahmatullahi wabarakatuh to all my friends and to our lecturer, which is Sir Muhammad Noor bin Muhammad. And today me and my group will explain the gait analysis of walking to my patient, which is Ahmad Iqmal bin Zainal Abidin. But before that, I will introduce our group members, which is me, myself, Nur Syafiqah binti Zainal Abidin, Muhammad Adin bin Muhammad Afandi, Husaini Sazwan bin Yusfa Nizam, Amir Akram bin Zain Azman, and the last one is Muhammad Iskandar bin Marozi. So stay tuned.
Hi, my name is Ahmad Iqmal bin Zainal Abidin and I have a lower back pain.
Okay, hi, Assalamualaikum. My name is Nur Syafiqah binti Zainal Abidin, and today I will introduce you my patient, which is Ahmad Iqmal bin Zainal Abidin that suffer lower back pain. Okay, I will tell you a bit about our patient, which is Ahmad Iqmal. Ahmad Iqmal is 17 years old and he suffers lower back pain from 2018. When he started having lower back pain was during the workout session 2 days before the tournament, which is when he does the deadlift at the gym. After that, he feel of lack of muscle control, lack of endurance of muscle, and weakness of muscle compared to the abdominal muscle. After he cannot survive, he submitted to the hospital and has been awarded for almost 1 week.
Assalamualaikum and hi, my name is Amir. Today I would like to share with you the definition of gait analysis and postural. So I know that some of you have already know what is gait analysis. I still want to share with you this information. So I hope that this information can add up your knowledge. So first of all, gait analysis is a powerful investigative tool together with the patient history and physical examination used to assess and diagnose patients suffering musculoskeletal pain and predict successful treatment of these pathologies. A basic analysis of a patient's gait and posture provides information about the body and capability of the musculoskeletal system to adjust to physical stressor. Besides, an understanding of normal gait and posture is essential for identifying and treating musculoskeletal pain. Addressing the underlying causes of the patient with pain resulting from gait and posture abnormalities is important in obtaining long-term pain relief. Other than that, video gait analysis is the systematic study of walking or running. Using slow motion film, it is possible to view joints in each phase of movement to assess if function and alignment is normal. It is also commonly used in sports biomechanics to help athletes run more efficiently and to identify posture-related or movement-related problems in people with injuries. For information, actually feet are amazing machines, managing without complaint most of the time to transmit the weight of the body as we propel ourselves around at varying speeds, all the while keeping balance and a secure connection with the surface. While foot posture can vary greatly without particular painful problems, many alterations in foot posture can result in painful symptoms and significant level of disability. The level of force transmitted through the feet demands strong and flexible joint, muscle strength and neuromuscular coordination for balance and control. That's all from me.
Okay, first of all, I want to explain to you guys about the waking gait cycle. We show you the body postural of the patient. As you can see, the patient have a good body postural because the disease which lower back pain does not affect the patient's body postural. The patient just feel pain at the lower back pain when do some activity. Now I will show you the video when the patients walk. After that, I will show you in detail the pace when the patients walk.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Adin bin Muhammad Fandi, and in this video I would like to explain about the basic component of walking in gait. Right, so in order to move through space, the individual must be able to propel the legs forward one at a time. When discussing about the biomechanics and the anatomy of this activity, it is broken into 4 major components for the purposes of discussing what is happening at the joints and which muscles are functioning together to perform this motion of the lower extremity. Right. So there are 4 basic components of walking in gait. The first one is heel strike. The second one is heel strike face. The second one is foot flat or stance face. The third one is toe off or propulsion face, and the last the last phase is the swing phase. Alright, so now we're going into one by one of the basic component of walking in gait. The first one, which we know, which is the heel strike phase. Right. During this phase of gait, during this phase of gait of the forward leg that is traveling through space, finds its initial contact with the ground, right? Initial contact with the ground for the next forward step. At the time of the contact, the first thing is that hits the ground is the heel of the forward leg. The heel of the forward leg. During heel strike, there is increasing in weight on the front foot, but the foot behind still carries some body weight and still contact with the ground. Alright, so moving on to the second phase of the basic component of walking gait, which is flat foot or stance phase. Okay, so during this phase of gait, which follows after the heel strike phase, the forward foot shifts weight from the heel onto the full surface of the foot. During this phase, there is full weight on the forward foot, with the other proportions of the leg length over the foot. The back foot has now left the ground and is in the air, moving forward during stance phase of the front leg. The trunk above also shifts forward over the leg as the weight is carried by this front leg. Okay, so for the third stage of the basic component of walking gait, which is toe off or propulsion phase. Okay, so this phase comes after foot flat, and this is the stage where the sets of the foot and leg up for pushing off the ground, and to propel that leg forward in space for next step. The weight continues through the middle of the foot in stance phase, and by the toe off phase, the weight now is on the ball of the foot. The opposite leg has now moved forward and is taking most of the body weight on the opposite side. The knee begins to bend, and the person then uses the ball of the foot to push off the ground and swing the leg forward. Alright, the final phase of the basic component of walking gait, which is the swing phase. This phase is where the final phase that occurs after the push off of the toe off phase. Once the push off has occurred, the knee is bent and the leg swings freely forward through space. And during this phase, all of the body weight is on the other leg, and once the leg moves past the body and forward in space for its next step, it begins again when the heel hits the ground for the heel strike phase of gait.
Hi and Assalamualaikum to my lecturers and my fellow friends. So today I am going to explain about the recommendations about gait analysis on lower back pain. Based on the research, exercise can increase the blood flow towards the lower back area, which may reduce stiffness and speed up the healing process. Some of the exercises that are great for that particular bridges. This exercise engages the large muscle of the buttocks, which is gluteus maximus. It is one of the crucial muscles in the body, and improving its strength can help support the lower back. Besides that, lower back rotational stretches are also an effective exercise for this purpose, since it can relieve tension in the lower back and trunk. It also works the core muscles in order to improve stability. The next exercise that are great for this reason is lying lateral leg lift. It works the hip abductor muscles. These abductor muscles will support the pelvis and can help in order to reduce strain on the back. Keeping this muscle strong is essential, as they help a person maintain their balance and can affect the mobility. Moving on, most back pain gets better within home treatment. Unfortunately, everyone is different. For an example, the pain does not go away for a few months, and a few have persistent and severe pain. You might have to consult the doctor, and based on the type of back pain that you have, the doctor might recommend this type of medications, which are over-the-counter OTC pain relievers, muscle relaxants, narcotics, or antidepressants. For over-the-counter OTC pain relievers, your doctor may suggest you to take non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen sodium. These two may help to relieve your back pain. Take these medications only as directed by your doctors. Overuse can cause serious side effects. And if mild to moderate back pain doesn't improve with OTC pain relievers, your doctor might also prescribe muscle relaxants. Muscle relaxants can make you dizzy and sleepy, thus it may help in order to relieve your lower back pain. And for narcotics, it is a drugs that containing opioids such as oxycodone or hydrocodone. It may be used for a short time with close supervisions by your doctor. Opioids don't work well for chronic pain, so your prescriptions will usually provide less than a week's worth of pills. And for the last one is antidepressants. Some types of antidepressants, particularly duloxetine and tricyclic antidepressants such as amitriptyline, have been shown to relieve chronic back pain independent of their effect on depression. Moving on to the last point, which is surgical and other procedures. These are an effective and a great way to treat your back pain. And some of the procedures that I use to treat it are cortisone injections. If other measures that I just mentioned before this don't relieve your pain, and if your pain radiates down to your leg, your doctor may inject cortisone. It is a strong anti-inflammatory drug. Plus, it will give you a numbing medication into the space around your spinal cord. And cortisone injections helps to decrease inflammation around the nerve rods, but the pain relief usually lasts only a month or two. The second one is radiofrequency neurotomy. In this procedure, a fine needle is inserted through your skin, so the tip is near the area causing your back pain. Radio waves are passed through the needle to damage the nearby nerve, which interferes with delivery of pain signals to the brain. The third one is implanted nerve stimulators. The doctor will implant the device under your skin, and it can deliver electrical impulses to a certain nerve in order to block the pain signals. And lastly, surgery. If you have unrelenting pain associated with radiating leg pain or progressive muscle weaknesses caused by nerve compression, you might benefit from surgery. These procedures are usually really reserved for pain related to structural problems such as narrowing of the spine or a herniated disc that hasn't responded to other therapy. And that is all from me. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh to sir. Okay, so I'm gonna present to you. I want to discuss the report about regarding a low back pain. Okay, so the objective is to difference in patients' gait and posture between a people with and without non-specific lower back pain during walking. So overall, we found the evidence between them that were not specific in terms of patient walking. So for those who suffer from for lower back pain, will difference walking rather than the normal person walking. So this may because a patient with they have to withstand the pain of walking, and then they have to strive to avoid discomfort while walking. Okay, in general, both group show a similar pattern of movement, but patient with back problems show much greater variability than other group. Okay, conclusion is patient with low back pain often have a difficulty walking and usually walk more slowly than their healthy peers, which is who don't have a lower back pain. So what they must to do, they need to do more exercise to avoid lower back pain. Alright, so that's all from me. Thank you.